I'm Debbie Kay. I'm a care manager here at Gaylord for almost 8 years. Been a nurse for almost 40 years. I met Colleen fairly close to the end of her stay here at Gaylord, and was given the task of setting up a safe discharge to home for her. She had amazing family support. She had a husband who was here every day. She had family that came from out of state to stay with her. So she had the family support. What she needed was professional nursing care to change her wound vac 3 times a week, home physical therapy, home occupational therapy. So working within her insurance, I set that up. She had her wound vac applied here at Gaylord prior to discharge. And I went in to see her wounds because I thought that I really should have a look at these wounds before somebody went home, and so that I could have a better understanding of what she was going through. I thought I had seen everything there was to see in all my years of nursing, but it was a real eye-opener, and it really kind of hit home the severity of her injuries. Despite the severity, it didn't dampen her spirit. And I think it was truly her faith in God and the love of her family that helped her get through such a trauma.
Now, had she asked you that she wanted to go home by, what did she say?
It was by
Thanksgiving?
Christmas.
Oh, Christmas. Okay,
yeah.
okay. Were you doubtful at the time that she could get home?
I wasn't sure. But as I got to know Colleen more and more, I realized that she was determined and that she was going to get home, and what I needed to do was to get on board with her and her family and get her home. It was important for her to be home for Christmas.
So what is the role of a care manager?
The ultimate goal is to set up a safe discharge plan to get the patient home or to the next level of care from Gaylord. We always aim for getting patients home. That's not always possible. It wasn't Colleen's case, so I had to work within her the benefits of her insurance plan and set up home care with preferred providers, provide clinical to them to support the need for her home care, and also order the wound vac as well, and provide authorizations to her insurance company so in the end that Gaylord would get reimbursed for the care that we provided.
Now, does every patient get a care manager?
Every patient at Gaylord is assigned a care manager. Our patients here are so complex that they need a care manager to help navigate through their journey at Gaylord, through whether it's trauma or recovering from a stroke or a spinal cord injury. So every patient has a care manager who's the link, the communicator, to try and bring together the big picture on what a patient needs to be able to be safely discharged.
So then you're also really familiar with a lot of things in the community?
Right, community resources, what home cares are appropriate within network. If patients need support groups, we work with other disciplines to see that patients get what they need once they leave Gaylord.
So how did it feel when you were able to get Colleen home?
I was tremendously proud. I was sorry to see her go. She has been and probably will be one of my most favorite patients that I have ever come to know. And I don't think of her now as a patient. It's almost 8 years after her accident, and I consider Colleen a friend.